we got here eventually. So yeah, I'm going to give a couple of case studies and talk a little bit around the issues of WASH. And I think one thing I want to make the point about is that when we talk about water and NTDs, we normally just talk about water as a habitat for various NTDs or their vectors. We've heard a couple of great presentations in that line today. But water, sanitation, and hygiene is about much more than just this. I think we have to remember that foremost, people with leprosy and NTDs, especially people with sort of long-term morbidity issues, are foremost people with the same WASH requirements as everybody else. Leprosy, as well as most other NTDs, are primarily diseases of poverty. So those affected have poorer WASH facilities. So I think even in terms of just identification of who will be the beneficiaries for a WASH program, people affected by NTDs and their communities should be prioritized because they're ultra poor in their own right and they're very much at risk of developing further NTDs. And of course, WASH will improve their general health, improve the safety. People affected by leprosy or LF have the same issues about going into the jungle to do open defecation as anybody else. They're at risk of rape, they're at risk of treading on a snake, they're at risk of falling down if it's a steep slope. And so we need to, and we also need to look at issues women and children. Again, people affected by leprosy, LF, other NTDs, especially those with mobility issues due to the morbidity, are going to find it even harder to carry water long distances. So I think we need to just keep a broad perspective and look beyond just disease to the total well-being of our clients. People with leprosy and other NTDs also face exclusion from WASH facilities. And they're going to be less likely to be selected for WASH support. When a development worker or a WASH worker goes into a community and looks about which households they're going to work with, they're unlikely to find those who are leprosy affected. Those people will be at the margins. They might be pushed to the edge of the village, even pushed out the village. And if there's a participatory process, they're unlikely to be invited to join it. In eastern Shan state of Myanmar, people affected by leprosy are actually expelled from their villages. And so in that area, you've got large numbers, well, quite a large number of villages which are purely of leprosy-affected people and their descendants. In Jaffna, in the northern province of Sri Lanka, leprosy-affected people are prevented from using community water sources due to stigma. And people affected with leprosy badly need WASH. Water is needed to soak and scrub limbs, to prevent cracking, to keep it supple, and to wash ulcers and wounds. And people who have disability due to leprosy or are suffering from ulcers or leprosy reaction need adjacent facilities. If you've got an ulcer on your foot, or you have blisters due to leprosy reaction, you're not able to go long distances to access WASH facilities. They also need to be accessible. If you've got a loss of limb, if you've got ulcers, you need to have a WASH facility which is disability accessible. And on top of that, that facility needs to be safe. Poor washing and sanitation facilities can be a source of infection. You need to have a smooth floor if the concrete is cracked, if there's stones, and you've got someone with leprosy who has an ulcer on their foot, compounded by the fact that they can't feel anything in their foot, that is a risk. So we need to make sure the facilities are suitable. There is also a contribution towards reduced leprosy prevalence through WASH. I think often people think of leprosy, oh, that's nothing to do with WASH. But actually, there is some research that has shown flies may be a vector, and the leprosy bacteria has been found in soil and water. We're not sure how much of transmission occurs through those means, but it is one way that transmission can occur. But even when you talk about airborne transmission, which is the main mode of leprosy transmission, there is also a WASH connection. Because 95% of people are naturally immune to leprosy. They think about perhaps up to 50% of that is due to genetic factors, but yeah, 50 to 70% of that immunity is related to the general health of the individual, which is related to, you know, if they're sick from other diseases, that will or other NTDs, that will suppress the immune system, as will poor nutrition. And so improving WASH and nutrition does reduce the prevalence of leprosy. And we have to remember that leprosy vanished from Europe and Japan and post-war Japan primarily just due to improvements in living standards, of which, of course, WASH and nutrition was an important part. And that was before we had any treatment drug whatsoever. In northeast Myanmar, we work through a partner, Christian Leprosy Mission Eastern Shan. This is a very remote, conflict-affected region. There's not just one rebel group fighting the government. There's about 4 or 5 in that area, plus pro-government militias. It's a tricky area to work in. And in fact, there are NGOs are either not allowed in certain areas by the government, or they're unable to work. And even the government is not able to penetrate much of the area. So we have been working. The great thing, on the other hand, about the area is the people, because they've not really had any donors, they're certainly not donor dependent. They're very self-sufficient, and so we basically give them the pipes for the pipe water supply, a little bit of cement, they find the sand, they build the water tanks themselves, they dig the holes, they maintain it. It's a very cost-effective method, and because they're involved in it, they have ownership and they maintain it. And so there we've been putting in gravity flow pipe water supplies. Here's a pipe in the process of being laid, and it basically comes from the top, a spring at the top of the nearest hill, and then it gets to the village. It goes through a sand filter, it gets stored in a water tank, and then it gets tapped to each house in the village. And then there's a committee, and the community contribute a small amount of money, which which pays for the maintenance. We also put in sanitary latrines. Again, the same model. The community build them themselves. Really, we just provide a few tin sheets and the cement. Even in one village, which was quite a long way from their source of sand, even children were carrying up sand. When everybody went down to the valley, they carried up a bag of sand with them for making the cement. Not quite WASH, but it's related to water. And of course, electricity at night, when you're involved in WASH activities, probably has a part to play in reducing disease. But it's a great little tiny mini hydropower just on a tiny stream, and it basically lights up 30 homes. We're also working in northern Sri Lanka through our partner Kaveri Kalamanram in northern province. Again, it's a post-conflict area. Formerly, it was, much of it was in the Tamil Tiger run, and it was in the midst of the fighting, which disrupted work on leprosy for a number of years. Here, the main issue, as mentioned a bit earlier, is really the stigma. yeah, I think the caste system is still fairly strong in the north of Sri Lanka, and there's incredible stigma and prejudice towards people affected by leprosy. Our partner there also does drama and a lot of community work to reduce that prejudice, but people are basically prevented from using communal sources of water. So this is another thing which must be thought about when WASH programs are being designed. And again, beneficiaries assist with labour. KKM also does hygiene awareness. They also do a lot of promotion on environmental health, on reducing pollution to the environment, on keeping waterways clean. And they also do a fair bit on dengue prevention. That started really because one of their field workers caught dengue and was ill for quite a bit of time. So, but I think it shows that where you're doing a program which has a lot of awareness components, it's very easy to add in awareness of something else. And in this case, adding in dengue is very easy when you're working with communities on leprosy awareness and general hygiene as well. And we're, in fact, going to be taking a similar approach in Bangladesh. There we've got a program which has been working on advocacy for leprosy, leprosy service provision and awareness. And again, it's very easy to add something in. So we're planning to add in awareness and advocacy on STH and on rabies. And yeah, and the other factor of in the dry northern Sri Lanka, water is needed for irrigation and agricultural livelihoods. So as well as providing people a source of water to drink, it means that they can water their homestead and actually grow various vegetables, crops, make an income, improve their nutrition. And that was the other interesting thing I found about in Eastern Shan State in Myanmar, is that even without any livelihood inputs at all, the economy of that community in one village I visited, Tangpo, had increased significantly. Just because of the fact people were no longer getting sick, they were healthier, they could be more productive. And so, to summarize really, the leprosy mission does do WASH interventions across all our target countries in Africa and Asia. And that contributes to preventing leprosy. It prevents waterborne diseases and other NTDs. I mean, the last thing we want is comorbidities. And what benefit is it for one of our beneficiaries to be treated for leprosy and then develop schistosomiasis or LF or something else? And I think one thing which I would suggest is, rather than us working on one disease, if we're doing awareness and work on something, we can add in other NTDs. It would be very easy if you're doing awareness, say on trachoma, to add in some leprosy awareness as well. And good WASH is needed for leprosy disease management and disability. I had a picture of a lady with severe elephantiasis a bit earlier in my slides. And the interesting thing, when I met her, she's part of one of our leprosy programs. We've included people with LF as well, is nobody had done anything for her needs apart from give her MDA. So when I met her, being part of this program and getting livelihood support and getting basically CBR support, it was the first time she'd got support at all. So again, I think we need to look at the whole person and their needs. It's not just enough to cure people, but we need to think of their long-term needs. And I think the education is important. Good health and education. If you're affected by leprosy or other NTDs, you're going to be discriminated. You're going to face stigma. If you have water close by, you reduce the burden on families, and you can carry that, you don't have to carry it long distances, and the children can complete education. It's giving them a chance that they might not otherwise have. Right, so I think my time is up. So thank you.